Welcome back. We have Misa Manshadi from Manshadi Pharmacy joining us. Thanks for being here, Misa.
Thank you so much for having me.
Absolutely. We're talking about a very important topic, the opioid crisis that, of course, we know has been plaguing our community, many communities right across the province, across the country. It is top of mind for many, and I think it's really quite timely to talk about this with you, just with the what pharmacies are able to do to help keep fentanyl off the streets and out of the hands of drug users. Maybe you can talk a little bit, Misa, about the opioid crisis itself. I know that overdose deaths are on the rise. Last year was not a good year, and neither were the years before that. But what are you seeing exactly?
Well, opioid use disorder or opioid addiction is a chronic brain disorder. When people use opiate repeatedly, it changes their physiology, their brain physiology and their brain neural pathways permanently. And this problem is like diabetes, and it's like having a high blood pressure. There is no cure for it. We have to manage it. And the pharmacies, they do their best by providing some opiate agonist to stop this repeat relapse of the people that they are afflicted with this addiction.
Let's put up, we have a few slides and we'll kind of go through these. These give you an idea. Of course, there you go, over 1,400 suspected overdose deaths in 2018, Misa. And I found this interesting, 80% male.
Yeah, they're mostly male, and it is mostly inside the property. That means you don't see them. Interesting part inside property is friends and families, they didn't even know that their kids or their husbands were afflicted with this condition, and they thought they were sober and not using any drugs. So, and then polysubstance is very important too, because people use illicit drugs and then they drink, or they use benzodiazepines such as, you know, Ativan or something else, or antipsychotic or antidepressant. So that combination also is very toxic.
Yeah, absolutely. And you kind of explained opioid use disorder, but maybe we can give people an idea on screen here, some of the points that that you were talking about. It is a problematic pattern of opioid use, as you talked about.
Correct. And there is a tool, that there's a diagnostic tool called DSM-5, and there is 11 criteria in there, and depending how many symptoms the person has, maybe if there is 2 to 3, that will be mild, maybe 4 to 5 will be moderate, and 6 and higher, they are considered very, they have a big problem on their hands. And so that's how we basically diagnose people when it comes to opiate addiction.
What are the signs that you can look for overdose then, Misa? I mean, you hear some of the obvious ones, you know, of you know, slow breathing and things like that, but there's more. There's much more.
Correct. So we have to basically realize there is overdose signs, and then there is intoxication. So intoxication, people can speak. They are sedated. They can talk, and so forth and so on. When it comes to overdose, is an emergency. They need to be going to the hospital, and we have to call ambulance. But the pupils are constricted. They can't breathe very well. They are choking. They are gurgling. They have problem with their lips, and their nails are sometimes blue. They can't. Their blood pressure is low, and sometimes they go to cardiac arrest and coma. So those are some of the signs of overdose. Correct.
And withdrawals is big when it comes to drug use, of course.
Correct. So,
and it's something I'm sure you see.
Yes, withdrawals is usually depending on if the person used short-acting opioids or long-acting opioids.
Okay.
So if the person uses short-acting opioids such as, let's say, oxycodone or heroin, withdrawals comes a little bit faster.
Okay.
When the person uses long-acting opioids such as, let's say, methadone, withdrawals comes a little bit later on. So it's the opposite of intoxication, is the opposite of the overdose, the symptoms.
Okay.
Yeah.
Let's talk about what you can do, I guess, if you, in the event of an overdose, if you see somebody who is experiencing an overdose or anything like that. What are some of the things that you can do?
So basically, when you see the person, really you have to differentiate, first of all, between intoxication and overdose. It's very difficult. So if you can't, call the ambulance. That's the first thing you want to do. If you have a naloxone, which is opiate antagonist, or also called Narcan, it has to be immediately injected.
Yeah.
I have brought one to show you here.
Yes.
And if the effects wears off within 3 to 5 minutes, then what we do is we do it again. We also have to give CPR, which is another very important component of it.
Show us the naloxone kit, Misa.
Certainly.
I know you brought it with you.
You can get these ones from the different community, Ask Wellness, some of the pharmacies. So naloxone basically is these drugs here is as I said,
so small, isn't it?
Yeah, it's an opiate antagonist.
Right.
Basically, we break it. We get it inside the syringe, and is intermuscular, so anywhere with the muscle would be fine.
Okay.
You basically inject it.
Okay.
And if there is no relief within 3 to 5 minutes, or if it's wearing off, then you need to re-inject it. Sometimes some places they have done even 5 times before
the person comes back.
Yes.
I know that pharmacies, Misa, this is something that's really important. Your pharmacy is actually testing illicit drugs for fentanyl.
Yes.
Tell us how that's happening. It's on your North Shore location?
Yes. So this is the combination of the Interior Health and Kamloops Ask Wellness. They partnered with some of the community member, Kip Mallory Pharmacy, Manshadi Pharmacy. And what happens, people, they bring their illicit drugs. And what we do, we test the drug. Very small, there's a specialized person that is in the pharmacy.
That's testing.
That will be testing the drugs. It's anonymous. That means there's no information required. Okay. They test the sample. It takes only 5 to 10 minutes, and they find out what the substance is and if it has been tainted with the other drugs, such as fentanyl. Obviously, it's not. We don't promote that now it's safe, you can inject it, but at least some individuals that they are weekend users, they can bring their drugs and it can be tested.
And know that they're not getting fentanyl in there.
Correct. And it's a very small sample, and then we give the sample back to them if they wish, and quick and easy.
Yeah. How important do you think that is, Misa, to be able to provide that as yet another tool to keep fentanyl out of drug users' hands and away from people?
It's not people that they do drug use on a regular basis. They are not going to come and test it.
Right.
Sometimes they want that high. Unfortunately, this is for more people that they are using it once in a while, and they are afflicted with this condition, and perhaps they need to test it. They are going, away for a month or a weekend somewhere, and they use these illicit drugs, and so that has those people usually probably are the one, or the students at TRU or those are the ones that probably going to come and use it, not the regular drug users.
All right. Well, thanks, Misa. So important. Of course, that you offer that on Saturdays from 2 to 4 at the North Shore location. There's the information on both South Shore and North Shore Manshadi pharmacies. We are back in a couple of minutes with the SPCA. Stay with us.
Thank you so much.